I'm not related to that actor either.
Hi everyone.
Hi.
Welcome to the Mindful Living Series Workshop. Before we get started, I just want to point your attention to the camera. We're recording this session, so none of the audience will be in the recording, but if you ask any questions or speak up, just know that that will be a part of it, or if you're walking in front. So we're welcoming Crystal Johnson here today. She is an RCC with a private practice. She has 10 years of experience in acute care and 25 years of experience as a diabetic. So her clinical practice focuses on helping people who are managing different diagnoses and medical problems and seeing them through that. So she has a lot of perspective on both sides of the issue, so we're really looking forward to this time.
Hi everyone. Thanks for coming out on this beautiful Tuesday evening. I'm actually impressed so many of you made it here. I was thinking about counseling. It was pretty nice out there today. So I wanted to start with looking at a picture here and kind of setting the stage since it is so nice and it's getting into the summer season. Just wondering if anyone could throw out a few words of what you think of when you see that picture, getting us into the summer frame of mind here.
Take a break.
Idyllic?
Take a break.
Take a break?
Family.
Family.
Why is he sitting there? Good comment.
Why is he sitting there? It's a good question.
On a group, right?
Separated from, yeah?
Spending time with children and teaching them something.
Spending time with children, teaching them. Yeah. And so those are all wonderful things to see in that picture, and there's certainly, when I've shown it to some of my friends, just say, oh, what do you see in this? That's definitely what people see. And I see all those things too. Some of the things, though, that I also see when I look at that picture, I see, okay, there's some food there. I wonder how many carbs are in that. Mm-hmm. I better think about that before I go and have that. Okay, it's summertime, so I've got my insulin pump, and if I'm going to go in the water, I guess I'd better figure out where am I going to attach that? What am I going to do with that? I see, okay, so there's the kids there too, and I don't know, am I ever going to have kids? And if I do, are they going to get this too? Is that something that's going to happen for me? That the guy in the back, he's not part of the family, so I wonder if he, do I tell him? Do I tell this person about that I have this thing that I'm trying to manage, or do I keep it to myself? What should I share with people? And, maybe someone's having a drink there too, and so it'd be nice to have a beer. It's a hot day, so I'd like that. And sure, I can do that, and I guess I can't have too much, because if I do, then I'm going to have to worry about getting too drunk, and what do I do if I can't take care of myself? That means I'm going to have to burden my partner with, he's going to have to take care of me. So those are some of the things that I see when I look at that picture, in addition to the idyllic, the pretty setting and the nice summer beach scene or camping scene that's there. And I just kind of wanted to use that to set the stage of some of the things that those of us who deal with chronic illness sometimes also are thinking about too. So now that we've kind of talked a little bit about that, back to about me. So as Victoria mentioned, I am a registered clinical counselor here in Vancouver. I've been a type 1 diabetic since I was 11 years old. It's definitely a part of my routine. It's part of what I do. It's something that I don't think about a lot until sometimes I look at something like that picture and I realize how many things that I'm just sometimes doing that I don't always appreciate until I get more into that burnout stage. And I think we all have things, and I certainly don't want to minimize the other issues that people have going on, but we're here to talk about chronic disease and how that can affect our lives. I have experienced burnout in the form of having depression, anger, anxiety. Those are all things that I have dealt with on and off. It's 25 years of dealing with the same thing. It can wear on you. It's okay. No problem. And I work with clients who also deal with different chronic diseases. Diabetes is a common one that I deal with, partly because of my own background, but also things like chronic pain, brain injury, actually something I've also worked with. And I am trained also as a speech-language pathologist, and so I have that background too, so I work with people with communication disorders as well. So I really have a very intimate sense of the medical system from both a provider perspective and then also as a consumer of healthcare services. So I'm curious, this workshop is generally put out for the general public. I know I've attended it before as a counselor wanting more information, and I have also seen people who are coming as just members of the public who want information for themselves. So if you're willing to maybe just raise your hands and let me know if you're someone who's looking at this for your counseling practice. Anyone who's coming as, okay. If you're coming tomorrow night, by the way, you're going to get a lot of overlap. There's a counselor cafe tomorrow. And people who are here from the general public who are kind of more interested for your own information. Okay, just gives me a sense of that. Thank you.
I'm in disability management.
Disability management, okay.
Yeah.
Okay,
I'm not a counselor, that's why I didn't.
okay,
raise my
fair
hand.
enough. More professional.
Well, I guess some days I am.
Yeah, exactly. You may not have that same qualification behind your last name, but
Yeah.
absolutely. So just to make sure we're all on the same page of what chronic illness is, so it's any health condition that people experience that is incurable but manageable. So it's usually through a variety of lifestyle, medication, and supportive therapies. So as I mentioned before, diabetes is one chronic health condition, chronic pain. More and more nowadays, there are some cancers that are really turning into being more chronic cancers as opposed to being terminal cancers. Neurological conditions like Parkinson's disease and Crohn's disease, and there's many, many other chronic conditions, but this just gets a little bit of a flavor of some of the different types of conditions out there. So as I said, oftentimes the therapies that are used, there's medications, and the medications, of course, are both helpful, but they also can have their own side effects as well, so they come with their own set of concerns. Monitoring, there's usually some kind of forms of medical appointments, perhaps therapies like an insulin pump or inhalers or some other kind of monitoring system, blood pressure monitoring. And lifestyle changes are often also part of dealing with chronic disease. So that could be in the form of exercise, diet. Some people use alternative therapies, supplements. This can all be part of chronic disease management. However, for the most part, we find that psychological needs are not really included in the healthcare system. The medical model tends to be a system that puts, there is the problem, and then there's a solution which involves some kind of medication. And that's oftentimes how it goes. And there's not always a lot of attention paid to the psychological and emotional effects of dealing with any kind of a medical condition. And I see some heads nodding, so I think there might be some people who've had that experience where it's just not brought into the healthcare plan, and it can be really disconcerting for people when they start having psychological effects and they don't really have any context to put that in. And often the healthcare team is not really aware of what to look for and what to offer people when there are signs of burnout or of having some kind of needs, supportive needs within the health plan. Do stop me anytime you have any questions, please. I also want to let you know I didn't print out the slides on a handout, but I have made them available to Victoria, and so hopefully if you're interested in getting the slides, you can email those out to you guys later, so they will be available to you after the presentation. So burnout is a topic that we often hear of in relation to work life. It's more commonly heard of when we think about people experiencing burnout from overwork and working too hard. But really, it's any kind of any situation where the long-term burden of the situation has exceeded our ability to cope. So that definitely can be the case with chronic disease. There is just no vacation from the daily management tasks. You have to keep doing it day after day after day after day, and that can be pretty wearing on people. Especially since one of the best ways of being resilient and managing difficult situations is related to hope. When we have hope, we're able to bounce back and to move forward in more constructive ways. And often with chronic disease, we can find that hope is lacking. and that prevents us from making the best healthcare decisions for ourselves sometimes. So again, coming back to that picture of the camping trip, everyone in life, if you're alive, you're breathing, you've got stress, you've got things that are weighing you down. There's work, there's jobs, there's kids, there's relationships, there's regular, your short-term illnesses. There's lots of things that are constantly, messing with our equilibrium in some way. And when you're dealing with a chronic health condition, there's things on top of that we're also dealing with. So there's doctor's appointments, there is the monitoring, adjusting the routines, following your diet, reading labels, coping with unexplained symptoms, educating family and coworkers. Others of you who deal with a chronic health condition, you end up doing a lot of teaching when you're dealing with this. You have to constantly be kind of telling people what it is you need and what some of the things that they should be looking for, ways that they might support you. And one of the things that I know I find infinitely frustrating is whenever I go out for dinner with someone and pull out the menu, and I find I'll be sitting at a table of 6 people and who know I'm diabetic, and I have 5 other people telling me what I can eat on the menu. I'm like, I've got 25 years of this under my belt, I think I'm okay, I can figure out what I can eat. But those are the kinds of things that are just sometimes, when enough of them amass over time, it can be really wearing on someone. That's sometimes how I feel.
How do you feel?
Some of the signs and symptoms that we can see with burnout, and that you might see either in yourself or someone is experiencing these right now, eh? Feeling overwhelmed, being irritable, having apathy or disinterest in your whole medical plan, depression, not taking part in some of the things you used to love to do, just wanting to stop trying so hard. Your relationships might be strained, and you might find that you're just not having the same patience for yourself, for your loved ones, feeling like you're actually a burden to your loved ones, and so withdrawing from them, feeling empty, feeling just tired all the time as well. Are there any other symptoms or signs that you guys can think of that you might see with burnout? Or have you experienced any of these?
People around you can't understand your problem.
Yeah. Yeah, feeling misunderstood.
Yeah.
Feeling ganged up upon, especially if there's a brain injury involved, so everybody's managing you, but feeling ganged up on.
Yeah, yeah. Not feeling supported. You
For your own good, ganged
Yeah.
up on.
Yeah.
Out of control.
out of control. Absolutely.
Self-pity.
Self-pity. Yeah.
Self-isolation.
Self-isolation, for sure. For sure. Yeah.
I've heard people, hairs falling off, more hair falling off.
So yeah, there's physical signs too, that's right, yeah, absolutely. Yeah, and I mean, all of these things too, like there's the psychological things of trying, of sometimes kind of separating ourselves from our lives, which is a lot of what I've heard here too, but there are very real physical effects of burnout as well, yeah. And so all of those kind of attest to the highs and lows that you experience when you're dealing with these health conditions. And it can go from, having that great blood test that you have and you're like feeling on top of the world and everything's great. You think, okay, I've got things under control. And a week later, you find you can barely get out of bed because somehow something's gone wrong and you're not quite sure what. And it's just really, really frustrating sometimes to feel like you can't trust your body. I mean, we're taught so often in this society, trust yourself, trust your body, listen to your body will tell you, your body is wise. And when you've got a chronic health condition, your body's not so wise. You can't just listen to your body, and so you've kind of lost that sense of ability to trust yourself and trust what's going on within you. And that can be really disorienting as well. And from all the people I've worked with, this is really normal. All these fluctuations are normal. And it can feel not only self-isolating, but it can feel like you're really lonely and all alone trying to deal with these things. And one of the things I found with some of the clients I work with is that simply knowing that this is normal, that it's okay, that you're having these feelings of, emotional roller coaster, it's normal, and that they find that really, really healing to know that this distress is there for other people too, that they're actually not alone in those feelings of kind of helplessness at times and feeling just the waves of dealing with their condition. So that kind of gives us an introduction to what burnout is, but the more important part of why you're all here is, okay, great, what can we do about that? It's all well and good, and it is healing to know that there are others who experience it too, and to have that normalize. But really, what are the steps? What are the things that we can do to help move ourselves out of burnout if we're there? The first time, give yourself a break. This comes down to the normalizing too, and part of that giving yourself a break is just stopping a little bit sometimes. And in the interest of that, I'm going to get you all to take a break even right now from the listening and just stand up, turn around 3 times, and sit back down again. Just give yourself a break from being listeners, being active listeners. You don't actually it doesn't have to be turned around 3 times. Just stand
Sure, no, it's gonna count.
Is it part 2 of your day, part 3 of part 4?
Yeah.
I like the guy just do that.
Yeah, I was looking at her and she said, "Thank you."
Literally and figuratively give yourself a break. That's helpful to do. And if there's anyone in here too that does have anything that they're having to monitor or any conditions, it's okay to get up, and if you need to go take care of something, you need to go take care of something. So being kind to yourself that you have needs, and that's okay to recognize them and to acknowledge them and to meet them. Yes, sir.
I'm wondering about having to sort of explain or justify to somebody why you're taking a break. I can see the idea that you just need a break, you govern yourself, some self-care, and you take it. But if you're having one of those days where you need more breaks or something, like how do you deal with not, say, over-explaining or sort of self-victimizing yourself and going, I need a break because I have, but people are going to sort of be saying, well, you're lazy, you're taking too many breaks, and they don't understand that. Is there a way to bridge that?
I think for me, what I have found, and a lot of people I work with, is that honesty really is the best, without being apologetic about it, and also without going down the self-pity route, but just saying, I have a medical need right now, and I need to take some time for myself. I need to take 5 minutes. And usually I find that if you're able to do that in a really kind of upfront way, people are pretty understanding about it. And it helps if you're able to say, I will, say you're at work, just letting them know too that taking this break means you're going to be more productive. And so just helping people to make that connection between this break is both good for you, but it's also good for your employer, say. I think simple and straightforward is often best. I think we sometimes get ourselves into a little bit of a pickle when we're trying to over-justify almost. And not easy, don't get me wrong, but I think that sometimes just keeping it simple.
And keep it non-specific. Like you said, medical need. You
I
can
think,
say I have, disability problem, or like how specific would you like to be?
I think that would depend very much on an individual situation. I wouldn't comment. Personally, I'm very comfortable telling people I'm diabetic, so I would be very open with that. But some people, it really depends on what your comfort level is around disclosing that information and who you're disclosing it to. I mean, there are people who it's not safe to actually disclose too much information to, and so I think it would, it needs to be done kind of on a case-by-case basis, really.
I was going to say, just from my own personal experience, when you face or are in a situation of explaining stuff, to remain as lighthearted as you can without minimizing the condition or what's going on, but at the same time not making it seem so serious. Because I think that fear plays a big part both for the individual with a chronic condition, a disability, and also with people that they're interacting with.
I think that's a brilliant point. Absolutely, yeah. Bringing humor and lightness into things does take some of the fear off of it for both parties.
Yeah.
Yeah, thank you for that. So step one, take a break. Give yourself a break. It's hard sometimes. In keeping, I guess, with this mindful living series, one of the things that I find I use a lot in my practice and also in my personal life is a lot of mindfulness. And Tara Brach, I don't know if any of you know her, she's a Buddhist psychotherapist, and she has an acronym called RAIN, which I find can be really good, especially when you're in that burnout stage where you're already past your stress level point, and so your ideal stress level, and you're finding that you're just not really coping very well with life. And so RAIN is basically a practice that brings you into mindfulness, mindful awareness of the present moment. So the idea is the R, you recognize what is happening. The A, you allow it to be as it is. I, investigate those inner experiences with kindness. And N is kind of the outcome that you can't really work so hard at, but kind of comes from the first three of non-identification. So, for example, if I've just had a really high blood sugar and suddenly I'm finding myself extremely stressed and thinking about what are the complications I'm going to have in the future, what does this mean to my overall health, what is this going to do to me, then my recognizing what is happening is, oh, I just went into anxiety. I just went into fear and anxiety. And the A, allowing it to be, is not trying to chase that anxiety away. A lot of the time, what our tendency is to try and push the fear, push the emotion and the feeling away. So trying to allow it to be there and investigating it with kindness. So starting to notice, what is it I feel in my body right now? For me, when I'm feeling a lot of fear, my stomach clenches up and my chest gets really tight. I notice when I start having bands of tightness around my chest. And the difficult part, but the part that I find works the best, ironically, is not doing these things, not recognizing it with the idea that it will make it go away, but doing it with saying, I'm just going to be curious about my experience right now, curious about what's happening in my body and what's happening for me right now. And in not trying to make it go away, it often helps it go away. And so then the end, the non-identification, is not becoming identified with that anxiety. So I am not my fear. I am experiencing fear in this moment. This is really stressful. This is really hard. This is making me think about things I don't want to think about. But what is the moment? What am I feeling right now? And recognizing that that is not me. That is my emotion, that's my feeling, but not me and who I am. There's, in the resources page, I have a link to Tara Brach's website. She's got some great resources there, and she really explains RAIN in a lot more detail as well. There's some guided meditations that are really good with her too.
Is she in West Van?
No, she's not local.
Oh, okay.
Yeah, I'm actually not sure where she's based at, but thank you. Thank you. So, and this is another one, is accepting imperfection. So even expecting it. We're going to make mistakes as we deal with our health. That's going to happen. I'm going to sometimes have that extra sugary drink that I shouldn't have, and that's going to wreak havoc on my blood sugars, and I'm still going to get up tomorrow and keep trying again. So not catastrophizing when those imperfections happen, allowing them to be there, and then taking the next step and moving on. Doing the best we can actually is enough. And it can be really hard to remember that when your doctor is sitting there wagging his finger at you and telling you all the things that you should be doing, and you're trying really hard, but we're not perfect, and we're never going to be, and so trying as best we can is enough. And when we're in burnout, respect our energy levels. Again, coming back to that needing to take breaks, but you may not be able to do all the things you normally do when you're in an active state of burnout. You're going to have to say no to some things, and that's okay. It's what you need to do in order to have that restoration and start to feel better and get back to the place where you can be doing the things you want to be doing again. So giving yourself permission to place limits on what you're doing and knowing that you need to do that in order to get better and to come out of burnout. And sometimes we don't even realize how overly active we are until we finally have that moment of rest. So take that moment if you can. And celebrate the small wins. This is one that can be really helpful when you're in the midst of kind of some depression and the loneliness around dealing with your health. Sometimes those are going to be really, really small wins. Really, really small. Sometimes for me, it's I smiled at the cashier today, even though I was feeling really sad and crappy. There's my win for today. I smiled. That's all I got. But it's a win. It's something that I've done, something that I can feel good about. And so that's going to be different all the time. But it helps you cultivate that awareness of the positives. There's research that shows, and many of you have probably heard of this, the 3 good things exercise, where you're noticing things that have happened to you, the good things that have happened to you, and when you do this as a regular practice, it helps you to feel more positive and have a more positive outlook. And so doing this in a really small way, even when you're in the doldrums, can be very helpful. And so it helps to cultivate that hope, too, that we talked about earlier, that hope that can be lacking sometimes when you're dealing with a lifelong condition. So noticing the small wins can help to kind of get you back in touch with that hope. So in the spirit of this one, I'm going to have you take 2 minutes and turn to a neighbor or someone around you and take a second to think first and just come up with one small win that you had today. Just one. And tell your neighbor. Neighbors. Tell someone. Write it down if you don't want to tell anyone else. That's fine too. Celebrating. Thank you guys for sharing. In celebrating the wins, it doesn't have to be telling a person. You might celebrate by journaling about it. You might do an art project about it. I really encourage you to, I have a therapist myself, and she encourages me to get up and dance around my living room when I'm, so you guys are lucky I didn't make you all get up and dance to celebrate your wins. But doing whatever it is that helps you to feel like you're celebrating this whatever your small win is, and bringing it to light and bringing it forward in your consciousness. So that's the idea there. And getting back to what this lady said here too, bringing some humor and lightness into things can be really helpful when we're in the stages of burnout. And sometimes this is done with other people. Maybe it's watching cute cat videos at home and just doing something to distract yourself. Forever distraction is not a good thing. You don't want to be consistently always distracted, but it has its place. Sometimes you need a distraction, and that's okay. And go to a comedy club, be around kids, watch some funny videos, do something that brings some humor and lightness into your life that is not related to your health management. Is a great thing to do. And ask for help when you need it. This is hard for a lot of us, but it really is important. Even if you've been doing this for years and years, and you've had lots of input from family and friends over the years, it's important to still be seeking out that help when you need it. Life changes, and as life changes, conditions might arise that put you into the stage of burnout, no matter how much of an expert you are at managing your health. And so knowing when you are in the stage of burnout and asking for support, it can be really helpful. And sometimes some of the symptoms are because of that self-isolation, because we are putting ourselves and setting ourselves aside from the other parts of our life. And that irritability with our partner can be because we feel like we have to do it alone and we don't want to be a burden. But it can be a great point of connection with the right supportive people. So find people who are on your team. Brene Brown has a term called marble jar friends, basically people who have shown you through their actions time over time that they are people who can and will be there for you. Tell those people, talk to them, reach out to them. And having those connections and those relationships are a big key again in that regaining hope and fostering hope again. And in asking for that help too, sometimes it can be great to recruit family or friends or loved ones into the health management itself. For example, I have a woman who I work with who has celiac disease, and so she brought her kids into that. So her kids are now label detectives with her. So they look up the label, they know which things to look at. So it becomes almost a fun thing for them, and it means that she's not feeling like she has to hide the looking at the labels and feel like, oh, mom's having to do that thing again that's so annoying for the kids. It's not. They're part of it. And so bringing other people into it, again, reduces that isolation, reduces that loneliness, and makes it more of a team effort. And get curious about the meaning of it all. And this doesn't have to be in a spiritual or religious context. We all often, we're kind of motivated by meaning and purpose in our lives. And having a meaning and purpose can help us to be resilient in the times of stress and difficulty. And it's quite an individual thing. For some people, the meaning and purpose might come from being in nature. For some people, it might be by sharing their story with other people to inspire them, and sharing their wellness story as well as their illness story. Could be through your relationships that you find your meaning. But get curious about what it is for you that is the meaning of it all. And for some people, this can be done when you're in the midst of burnout, and it can be helpful to help pull out of the burnout. For other people, it's too overwhelming to start looking at life purpose if you're really in a deep depression or anxiety. And so, again, I always encourage my clients to really look at what's working for them. You're the expert in your health. No matter what your doctor tells you, no matter what anyone else tells you, you're the expert in your own health. If looking for meaning is too much for you when you're in the midst of burnout, do it when you're feeling better. If it helps you to pull out of burnout, do it when you're in burnout. But remember always that you are the expert in your own health, or your client is the expert in their own health. And it's a good point of empowerment with that.
Can I say something?
Yeah,
Go
of course.
back to when you were talking about support.
Mm-hmm.
Like, for example, my experience, I didn't have the support of my family because they didn't believe in my disease. I got fibromyalgia, and it's not well known, especially in Italy because I come from Italy. So I had to explain every time to everyone, and I explained everything to my family, but still, they didn't understand, but they also didn't believe when I was in pain because, physically I look like fine, and I can jump and run, but I feel the pain, and I know when I can run, right, when I can't. But so now it's gone better, but it's not been easy. So my family and my idea of family is like your main support. They couldn't support me because they didn't understand, they didn't believe me. So
I see that being so very isolating. Yeah, really lonely being in that position. And that education piece of having to be the one to educate them can feel like a big burden when you're in the middle of that. And sometimes we need to pull in from the outside some people who are maybe not part of the family to be able to support this journey. One of the things for myself, I never attended anything diabetes related as a kid. I was like, won't do it. Nope, don't want anything to do with it. It's only been in the last couple of years when I've actually attended a couple of groups for diabetes and found like, wow, this is really liberating to be able to talk to people who are able to understand. And so sometimes that source of support might have to come from people who are outside of what is normally our family circle, which can be distressing in itself, for sure. You want your family to be there to support you. Sometimes we have to advocate in different ways for ourselves. Thank you. Thank you. So those were kind of that first part there is about what to do when you're in the midst of burnout. And even better, of course, we all know prevention is best, so trying to prevent the burnout. So this is, you're not having to do a lot, don't worry with your piece of paper, but this is, over the next little bit, I just want to talk about kind of creating your own self-care toolkit. So the piece of paper is for you to start jotting down ideas, either ones that I say, ones that you have yourself, about what you would put in your own self-care toolkit. And I really encourage my clients to post this in their bedroom, on their fridge, post it somewhere so that where it's visible and reminds them of the things that they do, the restorative practices that they have that are going to be nurturing themselves. Because we all probably know the things we need to do, but if we don't see them, they get put on the back burner. They get at the bottom of the list after the grocery shopping and the laundry's done. I'll get to self-care. And really we want to try and move that up on our priority list in order to prevent burnout. And having that on a piece of paper somewhere can remind you in a lot of ways too that this is part of your healthcare plan. And so maybe your doctor hasn't said to you, you need to go and do yoga every day. But if you find that doing yoga every day helps you to be able to go to work every day, then it's part of your healthcare plan that is really important. So keeping your own awareness of what your practices are that within your own self-care toolkit. So here's some first ideas that I have, and there are more to come later too, but physical activity is a great one if you're able to. I recognize that chronic health, that may not always be easy to do, and so that might have to be adapted depending on what your physical limitations are. Walking, yoga, things that are gentle can be really, and outside, being in nature, doing that physical activity in nature can be even better for self-care. I am really big into the meditation and mindfulness practices. I find they have a huge influence on my ability to stay centered and grounded in the midst of troubled times. So I very much advocate for people doing that. Visiting with friends, again, fostering that connection. Now, in the previous when we were talking about being in burnout, sometimes that connection is asking for help. When you're not in burnout, you probably want to also make sure you're having times when you're doing stuff with friends that have nothing to do with your health, both for you and for them, so that when you do have trouble, you feel like, okay, well, I haven't been talking about this every day for the last 3 months with them, so now that I am having trouble, I can reach out to you and ask for you for that help. So making sure you're kind of balancing out those things that you're doing. Creative pursuits, singing, dancing, painting, those are all great to discharge some of that emotional energy. Journaling, I'm a big journaler as well, and a lot of the people I work with really find that journaling can be helpful. And oftentimes the journaling can be really helpful too when you don't necessarily have the supportive family network that you're looking for or that you'd like to have. It can be a place to get some of those thoughts out on paper. Even writing a letter to a family member that you don't send can be a great thing to do, just to get those emotions, discharge them, and be able to have that experience. And scheduling yourself some downtime and some playtime. I was here a few months ago for the play therapy workshop, and it was brilliant and wonderful, and how interesting how quickly I have neglected to put play into my daily life, but it's such a fun thing to make sure that you're building in fun things to do in your life. And as part of the preventing burnout is we actually need to grieve our losses. And this is not to say that with an illness that you can't live a perfectly thriving, fulfilling, beautiful life. We can, we do, but there may be things that you may not be able to do that you once thought you would do. This is true of anyone too. I mean, we can't all win the lottery. We can't all be in the NHL. That's just reality. And I think that sometimes with an illness, there are other things too that we may not have the same opportunities to do. And one of the best ways to move forward is to actually take some time to sit with that, to grieve that, go through that process of recognizing and acknowledging some of the things that you may not be able to do that you once dreamed you would do. When you take the time to actually do that and to grieve those losses, then you're in a better position to set new goals, goals that are achievable for yourself. And again, setting those goals that are achievable is going to help you build that hope for your future. So again, looking towards that hope.
Is there a way that you would suggest that someone, that we could recommend people do that? Because it's going to be scary for them, going down that thing, and they might not see how they can emerge from that.
Yeah. One of the things, being really familiar with Kubler-Ross's the stages of grief is helpful. I thought that people can resonate with where they are in that experience with the certain losses. You can use art sometimes too, of like actually drawing what is the life you thought you would be living, what is the life you're living now. And one of the more healing ones too in terms of that moving forward process is writing a letter. I'm big on writing, as you can tell. Writing a letter to the illness. You want to do this in stages too, is writing the letter to the illness of this is what I have lost, this is what you have taken from me is your illness, being able to be angry with that, and then writing a second letter kind of counteracting that of saying, and this is what I have learned from the experience. So making sure that you're not just opening it up and saying, this is what I've lost, that's it. You want to actually start closing that up again too, and getting people to look at, and this is what I've learned, what I can take forward in this. This is the strengths that I have garnered out of that experience.
If someone isn't really interested in doing that, yet they seem kind of mired in kind of a self-pity, but they don't really want to, they're afraid that acknowledging that loss is going to just make them even more depressed. Would you still pursue that with them, or would you just let that go?
I think it would depend very much on kind of the context of that situation. If it's preventing them from, kind of what other effects it's having in their life. I mean, that might be a time when I'd start using a little bit of motivational interviewing and really getting them to kind of take a look at both sides of that. Like what is it that you want for your life? What is it you're holding on to? And getting them to start to see that discrepancy between you can't sit in that place of wallowing and also get to this place of healing. And so really trying to, as best I can, develop that discrepancy for them until they are getting to the point where they're at a stage of change where they're able to start taking some action.
Yeah, it's like exploring what's the payoff for you, because we get a payoff staying in our self-pity, resentment.
For sure.
And that's something, I work in addictions, that's what we always ask is, what's your payoff? What are you getting out of this?
Yeah.
Well, yeah, that's just it, right? So
Yeah.
we get the motivation behind it.
For sure. Helpful?
Thanks, yeah.
So again, preventing burnout, looking at exploring your values and your strengths. We don't often take time to explicitly look at what our values are, and yet it can be a really helpful thing to do, whether you have clients with chronic illness or you have chronic illness yourself or not. It can be helpful to really define what is important to you in life. And there's a number of different values inventories, and you can take on the internet, on the resources page when you get that one. I've got a link to a couple of them that I like that are pretty simple that get you to look at your values. And once you have those values a little bit more clear in your mind, you can look at how you might apply that to your healthcare situation. Flip forward and I'll flip back to this one. So looking for balance, because so in defining your values, what that can help you do is figuring out what matters to you in your healthcare management. So it's somewhere between being completely analytical about every little thing in your healthcare plan to having your head in the sand, right? There's got to be a balance somewhere in between. And again, you're the expert in your life. That's going to be different for everyone. Some people, having that piece of cake with their best friend in a cafe, okay, you know what, it's probably not what my doctor would recommend, but that moment of joy and connection, that's worth it for me. I'm going to do it. For someone else, they may have just had their first grandchild, and they're really looking at, I want to do everything I possibly can in this moment to be around for that first grandchild's graduation. And so they're more comfortable being more vigilant about what they're doing. And so this might change and fluctuate over time with your different stages of your life, but it's your choice. You are in control of what you are choosing to do and what values you're living in terms of your healthcare management. Going back to this one too. So in addition to values, looking at your strengths and how you can apply your strengths to your health situation. So another little experiential exercise, because I want to keep you guys awake late at night. So I want you to turn again to a partner and try and think of a very short story, because we don't have that much time. Probably spend about 5 minutes each. And just a short story about some time when you've had something where you've overcome a difficulty. And, you know, this might be, you found that parking spot the other day, something. It doesn't have to be big. You don't have to think of anything too major or earth-shattering. And what you're going to do is I want you to listen to your partner's story, and I want the person who's listening to try and pull out what is the person who's telling the story, what are their strengths that you can see in that? And then you're going to do the same thing for the other person. So just listening for each other's strengths in that story, and then identifying those two to one another. Does that make sense? No?
Not to me.
Okay. So telling, so you tell a story about it sometime you've had a difficulty to overcome. And then, Sarah's going to listen to that. She's going to listen to your story, what you've overcome. And she's going to listen to the strengths that you're demonstrating. Does that make sense? Okay. How was that experience from you all? Do we have any comments on, were they surprised at the strengths that their partner identified, or did they already know those strengths about themselves?
We noticed that the reward of challenging things is based on the pride. That if you challenge something, even though the odds are against you or seem to be against you because of your disability or your challenges, that to try a little bit, the pride builds up and it gets stronger. So there's self-pride, I guess.
Yeah.
And there's a strength there. So even if you go a short distance and somewhat falter, you still say, well, I can go that short distance, and I didn't just stop and do nothing. So
You've made an effort.
yeah.
And that's definitely something that you can, knowing that strength in yourself, that ability to kind of persist even in the face of hardship, is certainly something that you can apply to the health condition and to any burnout that you might be experiencing. Any other comments on that experience?
It's really nice complimentary to hear stuff like that.
Hear someone else.
Yeah, to hear someone else
Yeah.
see like different things. Yeah.
Yeah. And I'd encourage you to jot down what your partner wrote or what your partner spoke about with your strengths. Keep a note of that. See what someone else is seeing in you. It can be hard to see that in ourselves, to see where some of our strengths lie. And knowing what those strengths are, again, can help you to recruit those strengths through the hard times. Did that one already? So finding flow is another way of helping to prevent burnout. So looking at what is it in your life that gives you that experience of flow? We all have that thing that you end up doing where you suddenly realize, 6 hours have gone by and you forgot to eat and you forgot to sleep and everything has just completely gone out the window because you were so consumed by that thing. And if you can, try and find out what that is. What is that flow experience for you? That is, if you can tap into that, that is something that if you make sure that you then take time to do that in your life, that's going to, again, help you to prevent burnout because it's going to give you that experience of meaning and purpose oftentimes. It's often related to meaning and purpose, and give you that positive life experience that can sustain you through some of the more difficult times. And strive as much as you can for authenticity. I've been highly influenced by the work of Dr. Brene Brown. I run a group with a co-facilitator who has done the training with Dr. Brown. And some of the work that has come out of her research is quite relevant to health conditions about shame and vulnerability and how that pathway to really authentic connection and wholehearted living, it comes usually out of us being able to share our stories, share them with that willingness to be vulnerable. And that it's a scary place to be, of course, to be that open and to be willing to share our weaknesses and share all of our shame triggers. But that is the way that we can actually have that deep connection that most of us are craving on a lot of levels. To have someone see you and accept you and love you, that comes only from allowing yourself to be seen. Now, this is again, when we come back to those marble jar friends, you don't want to go into work on Monday and, hey, here I am, I'm going to show you everything, this is all me. No, you want to make sure that the people who you are sharing with that have earned that right, have earned that trust. So that's something that takes some time to build up. But try over time, if you can, to build those marble jar friends, those friends where they do those little things that let you know they are someone you can trust. They are someone who is going to have your back. And then those are the people who you can really keep it real with. You can share your story and share your authentic self, and that is going to be very sustaining for you as well. A few more prevention tips. Share your stories with others. Explore your personal signs of burnout. Notice what it is that for you are the danger signs. What is it you need to be watching for? And then share those things with people in your life who might be able to help identify them when they're happening as well. People who'll be able to say, Crystal, I think you've been kind of pretty irritable lately, and you're not really paying attention as much at work, and wonder if maybe you need to kind of step up the self-care a little bit. Share that with some people who are able to look out for you if you can. And if you don't have someone around like that, then again, maybe making a poster of what those things are and checking in with yourself. Really be checking in with yourself honestly and regularly about how you're doing. We, again, are bombarded with messages in our society that we should all be Superman or Superwoman and have it all together. But pretending to be that when you're not actually feeling that way doesn't actually work. So if you notice you're going in a spiral, you need to try and recognize that and see if you can pull yourself out of it and start doing those things that you need to do for your restorative practices. And having that awareness and knowing your signs also makes it easier to ask for the help and to check in with your healthcare team as well and find out whether there's something that they can be offering you in addition. So why don't you just take another look at your pieces of paper that you have with your own toolkit and maybe spend a couple minutes just finishing that off. I'd love to hear if anyone else has any other ideas about what you would put in your self-care toolkit. Maybe we could share those with the group. Anyone have any other practices or things that they would put on in their toolkit?
I've got one.
Yeah.
Taking lunch at work.
Taking lunch, yes. Now, do you mean actually taking a break at lunch, or do you mean
Yes, taking a break at
taking
lunch.
a break at lunch?
Yes.
That's a brilliant one. Yes. Yes.
About caring for others and sort of getting the focus off the self.
Yes.
Volunteer. Oh, yeah.
Yeah. I think that's
Oh, yeah.
a
that's
great way to
huge
connect
one.
with other people. Yeah, and sometimes with the connecting with communities too, communities of maybe people who have a similar condition that you do, that can be a great place where you can connect on both a receiving advice level but also giving advice. And you're absolutely right, that reciprocal ability to be someone who's contributing as well has a huge effect on our ability
Yeah,
to.
because it's kind of, you feel that you get that self-efficacy, you can boost out of that too.
Absolutely, that's great. Thank you.
You could start a group,
Start a group.
read a book or a book club or a walking group or anything just to connect with other people.
Yeah, I like that. That's great. Yeah, ways to reach out and foster some common interests as well.
Try to shed some of that isolation.
For sure. For sure.
Will you be talking about, and when you're truly dependent on other people, if it's a pretty serious physical disability, and you don't feel that you can trust them, that you can reach out to them, and you're in a deep hole?
So can you ask the question again? What do you do in that situation?
Is that part of the presentation, or should I hold it till the end?
It's not something that I have touched on here in terms of when you're completely dependent on another person. It's kind of a different level of, let's say, ability to be empowered in that situation. And that can be a pretty fragile place to be. Absolutely. It might be something that if you want to come and talk to me a little bit afterwards, maybe a conversation.
Most of the cases that I came here tonight for are people who would be really hard pressed to come up with a whole lot for that because the disabilities are quite far-reaching.
Okay.
I would actually like to hear you speak on that, actually.
Yeah.
Just as sort of a context, it could be MS, it could be cerebral palsy, it could be the onset of Alzheimer's or dementia, any of those. Yeah.
And some of those, I don't work with a lot of those ones directly, other than in my role as a speech pathologist when I work at the hospital system, where I'm more working in the acute care setting rather than working directly on the counseling issues. And a lot of the times, the kind of work that I'm doing in those situations is more focused on its immediate symptom relief. It's harder to have some of these, as you're kind of pointing out too, have these restorative practices that require a lot of ability to participate and to think and to be able to physically partake in those things. And so,
Or financial resources.
financial, huge one,
Yeah.
huge, big, yeah. And that, for me, is where I use a lot of the mindfulness-based therapies. I think that mindfulness is what comes into play a lot in those moments. It's looking at getting in touch with the moment as it is, and it's not a cure-all, obviously. It's something that I think can help reduce the distress of the moments when working with some of the mindfulness and breathing techniques and mindfulness are the two that I would say would be my go-to ones for people who have a lot more of the physical dependency issues. And being able to, the ideal would be to have people who you can recruit to bring in things of beauty. So being able to, you can't get out in nature, okay, see if we can get some plants into the room. Seeing if there can get some pets into the hospital. So trying to bring some of these other elements into the physical environment that is where there's their limited space. Is that helpful? I know there's a lot more to.
To some extent, it is what it is.
Yeah.
I think it's also important to have them focus on, encourage them to acknowledge, to appreciate the little things that they can do. That everything counts, as small as it may be. It could be a huge thing.
There might also be an element too of education there for the providers who are around them. I think that sometimes can be a part of it. Might be even more essential than for the person themselves, is being able to have that education, or for the people around them, how best to support that individual.
That struck me when you were talking about sometimes, if my family doesn't believe me, is there a different outside resource that I could bring in? Somebody else who has the same disability, that they wouldn't be my daughter or my sibling. They'd be an outsider saying the exact same things I'd already said, but they might get a different kind of hearing.
Yeah. Yeah, sometimes having that second, someone without that same attachment can be useful. Thank you. And the very last part of the presentation is just talking about when to seek additional help, because sometimes we can't do it alone. Some of the things that you might want to look for in yourself or your clients. If you're noticing that there's uncontrollable anger, if there's relationships are in jeopardy, poor work performance, panic attacks, not doing the basic healthcare needs that you need to get by, and recurrent thoughts of death or suicide, these are times when using your own toolkit is not enough at this point. If there's crisis, if there's any talk, and those of you who are counselors know this, if there's any talk of suicide or suicidality, call 911. You don't mess around with that. You want to make sure that you're making sure people have access to that resource and take it seriously. And if you're having any of those thoughts yourself of suicidal tendencies, reaching out, go to ER, go to wherever you need to do, call someone immediately, but really making sure that taking those thoughts and those ideas very seriously. Other areas that you can turn to if you are having difficulties and not able to deal with it on your own. Counseling, obviously that's kind of my bias, but spirituality and faith is another place where people find a lot of strength. I think that it can be something that can be more accessible to a lot of people in a lot of different settings as well, is that there can be that spiritual element, faith element. A lot of religious organizations also have some kind of spiritual counseling available, pastoral care of some sort, so that can be a resource that can be accessed for some people. As well, the spirituality and faith groups often provide another place to find that connection, that sense of community that might be lacking in terms of one's own immediate family or social circle. And your medical team, I mean, for all that the medical system may not be ideal, there are resources there too, and there are people who can help you. And sometimes there might be a reversible cause of what is going on for you. So don't want to discount that fact that sometimes some anxieties or racing hard, or that might be caused by your medication and nothing to do with burnout. So wanting to make sure that you do explore that medical side of things too, and make sure that there's not a reversible cause that could be contributing to what you're experiencing, your symptoms are. Above all, be kind to yourself. Remember this, wherever you are in your journey, you deserve compassion for yourself. And that is, I think, when you're able to give yourself that compassion, you're going to take better care of yourself, and you're going to be able to do some of these restorative practices. And, we're going to screw up, you're going to make mistakes, you're going to sometimes have really great health and sometimes not. Sometimes you're going to feel wonderful about the world and sometimes not, just like everybody else. And I would encourage everyone to be kind to themselves through it all. So there are some resources here. As I said, they will be on the handout that goes out. And just want to express my gratitude to my partner, Kurt, because he is here, and he actually contributed a lot in terms of some of the content of this. So thank you. Gratitude, another great practice. So thank you to him. And I'm a little bit early, but I guess it leaves time for questions. If anyone has any questions, we can answer questions as a group, or I'm happy to stick around for a little while as well if anyone wants to speak.
I'm a little bit wary of the finding meaning part. And maybe that's because I'm an atheist. But, I think there might be some people who, the immediate go-to meaning is that, they're a victimhood, right? And they're like, that's where they will tend to go. So I'm wondering if you're inviting that finding meaning, how do you accomplish that?
It's not been my experience with the people who I've worked with, and
Okay.
I've found that people generally, when they're looking to find meaning, they're finding a way to make sense of it. So as long as the loss has been grieved properly, as long as someone has had that time to look at what they have not had, those things that have gone wrong, and be able to experience the sadness and the grief and the anger about all of those things, then the tendency that I've seen with people is that they want to make sense of it in a way that moves them forward in a positive way. So they're going to look for, okay, so this sucks and this is really hard, and I didn't want to have cancer, but maybe now I can go talk to other people about my experience. That's kind of the more typical one, or the stereotypical idea of the workaholic who has a health condition and suddenly realizes, okay, there's more to life than just work. Maybe there's my family as well. So that meaning doesn't have to be in a spiritual context. It's more finding what are those things, maybe even just flow experiences that can give meaning or shape to our lives. I do recognize, and I certainly acknowledge that meaning and purpose are pretty loaded terms for a lot of people. And so it's,
well, I mean, even if you're religious, and you attempt to find meaning, you may come up with the idea that God has it in for you. So it just seems a little bit scary area to explore. I don't know if it's just that I'm not asking the right question or presenting the right question.
I've worked in bereavement for a number of years, and what I have found is that, and it goes back to that, being able to look at it and what have you learned from it? How have you grown from it? And I find that as time goes on, never at the beginning, when you're in the thick of it and you're just feeling the pain. It's when things get a little bit better. It's not in a crisis moment, it's when the crisis has lifted. It's amazing how people really are able to kind of take a step back and go, wow, you know, that wasn't how I wanted things to go, but I wouldn't have maybe achieved this, or I wouldn't have learned this about myself, or discovered this strength. I wouldn't have grown in certain ways unless I had been through that. And that's how they kind of take from it that it wasn't just pain for the sake of pain. Does that make sense?
Yeah, that helps.
Yeah, so that's kind of, it's, for some people it has a spiritual sense, but for more the way I've experienced it is just, meaning, purpose. What can I take from this, that it just isn't all pain and sadness?
Thank you.
I have a question. Do you make the PowerPoint accessible if you request it?
Yes, so Victoria will be able to send that out to people.
I have a question. What about, or I was wondering if you could speak to the experiences of, and maybe any recommendations you have for people that have progressive chronic illness, where there's sort of a series of losses, and so grieving becomes the sort of extended long-term project, and so there's sort of little losses and bigger losses, but it's sort of ongoing.
I think it's a much more challenging situation, for sure. I think that sometimes it comes back to some of the same things that we talked about before, about that mindfulness and noticing those little wins within the moment. And I think there's also another place where that meaning and purpose can come into play, of being able to reconnect to what is that overall way that you're able to make sense of what is happening to you in that situation. And I think one of the things in that particular situation is that part of what that grieving process and the challenge is that recognizing that there's not going to be a happy ending, that there's not going to, the pain is going to be continuing. So it's almost like finding a way to make peace with some of the pain that's going on, rather than being able to look forward to it passing on completely. Is that kind of, I think it's requires a lot more stamina on the part of both the person experiencing it and also of having a very strong support network around to help buffer that person.
So it sounds like one big part of the work would be accepting the loss and grieving. But what happens if, let's say, if an individual is not, the idea of hope, because you started by saying hope is an important part, that hope is I'm going to or I'm going to return to whom I was before. So I want to be before the onset of the disease or illness or an accident, let's say. So that's the hope that the person is dearly holding on to. And the loss, accepting the loss is letting go of that hope, right? So it's contradicting for the person. So it's very challenging for the person to accept that.
Absolutely, and I think part of that what the work in that situation, I think, is looking at the fact that you can't become that person who you were, and so that is not a quick process to get there. And looking at, okay, so this is not going to be the life that I wanted. How can I readjust my dreams and hopes? Well, how can I look for new goals that are actually going to be possible in my life with the new set of limitations that I have? Not everyone gets there, but it is a matter of kind of reframing the experience in a new way.
Okay, if that's all the questions, I think Crystal's going to stay a little bit longer and continue to answer anything for you guys. So thanks again for coming. Anyone who'd like these PowerPoint slides, please put your email, make a note of it on the feedback forms, or if you didn't fill out a form, just leave it with me over here, and I'll make sure you get a copy of that. And just thank you so much for coming and giving that presentation.